Have you ever noticed that as we age, our world doesn't always look as sharp and colorful as it once did? Maybe reading small print feels harder, driving at night isn't as comfortable, or you sometimes rub your eyes and wonder if something is changing inside them. What if I told you that many of these shifts are linked to a handful of common eye diseases that millions of seniors experience? But the good news is, with awareness and the right steps, much of the damage can be slowed, prevented, or even managed naturally. That's exactly what we're talking about today. Before we dive in, make sure you hit the like button, subscribe, and leave a comment if you've ever experienced changes in your vision, because your experience might help someone else watching this video. Now let's begin. The truth is, our eyes are some of the most delicate and complex organs in the body. They work tirelessly from the moment we wake up until we close them at night, processing light, colors, depth, and movement. But as the years go by, wear and tear, underlying health conditions, and lifestyle factors can lead to specific eye problems. 5 of these conditions are so common and so important that every senior should know about them: cataracts, glaucoma, age-related macular degeneration, diabetic retinopathy, and presbyopia. Each one affects vision in a different way, and understanding them is the first step toward protecting your sight and independence. Let's start with cataracts. Imagine looking through a foggy window. That's exactly how many people describe what cataracts feel like. A cataract happens when the natural lens inside the eye becomes cloudy. Normally, the lens is crystal clear, allowing light to pass through easily and focus sharply on the retina. But with age, proteins inside the lens start to clump together, scattering light and creating blurred vision. Cataracts are incredibly common. By the age of 80, more than half of Americans either have cataracts or have had surgery to remove them, according to the National Eye Institute. Now, here's what makes cataracts especially important for seniors. They don't happen overnight. They build slowly, often over years. At first, you may just notice glare when driving at night or needing brighter light to read. Colors may look faded or yellowed. These subtle changes can sometimes be brushed off as just getting older, but in reality, they are early signs of cataracts developing. Here's the encouraging part. Cataracts are highly treatable. Surgery, where the cloudy lens is replaced with a clear artificial lens, has one of the highest success rates of any medical procedure. But before surgery is needed, there are natural steps seniors can take to slow the progression. For example, protecting your eyes from ultraviolet light by wearing sunglasses and wide-brimmed hats can reduce stress on the lens. Diet also plays a role. Foods rich in antioxidants like vitamin C and vitamin E help protect the lens from oxidative damage. Think of oranges, bell peppers, almonds, and sunflower seeds as powerful allies for your eyes. One long-term study from the American Journal of Clinical Nutrition found that people with higher intakes of vitamin C had a significantly lower risk of cataract development. And there's more. Staying hydrated and avoiding smoking can make a huge difference. Smoking, in particular, doubles the risk of cataracts because it creates free radicals that damage lens proteins. So if you've been looking for one more reason to cut down or quit, your eyesight is a powerful motivator. Cataracts are a perfect example of why awareness matters. When seniors recognize early symptoms and make small lifestyle adjustments, they can delay the need for surgery and maintain clear vision for longer. And remember, routine eye exams are your best line of defense, because cataracts, like many eye diseases, can sneak up quietly. Now, let's move on to glaucoma, often called the silent thief of sight. Why that name? Because glaucoma typically causes no pain, no noticeable symptoms at first, yet it slowly damages the optic nerve, the vital cable that connects your eye to your brain. Once that nerve is damaged, vision loss is permanent. And the tricky part is, people may not realize they have glaucoma until their peripheral vision begins to fade, which could be years into the disease. According to the Glaucoma Research Foundation, more than 3 million Americans have glaucoma, but only about half of them know it. That's a staggering statistic. Seniors are at higher risk, especially those over 60, and certain groups like African Americans and Hispanics are even more vulnerable at earlier ages. So, what actually happens in glaucoma? In most cases, fluid builds up inside the eye, increasing pressure. This pressure slowly crushes the optic nerve fibers, leading to blind spots. Without treatment, glaucoma can eventually cause total blindness. The scary part is, this happens gradually, making it easy to miss until significant vision is already lost. But here's the hopeful side. Early detection changes everything. Regular eye exams with a simple pressure check can catch glaucoma before damage sets in. Treatment often starts with prescription eye drops that lower pressure, and in some cases, laser therapy or surgery may be recommended. But just like with cataracts, lifestyle choices can support eye health naturally. Foods rich in omega-3 fatty acids, like salmon, flax seeds, and walnuts, support healthy circulation to the optic nerve. Leafy greens such as kale and spinach contain nitrates that help improve blood flow. And studies have suggested that higher intake of these greens is linked to a lower risk of glaucoma. Physical activity also plays a role. Gentle exercises like walking or yoga can help lower eye pressure, though it's important to avoid poses that put the head below the heart for extended periods, like headstands, which can actually increase pressure, managing overall health conditions. Like high blood pressure and diabetes also helps protect the optic nerve. Think of glaucoma as a quiet guest in the house. You don't know it's there until it starts rearranging the furniture. But if you keep up with your regular checkups and make healthy lifestyle choices, you can stop it from ever getting the upper hand. I want to pause here for a quick reminder. If you find this information helpful, please subscribe and share this video with a friend or family member who might benefit. Eye health education can make a world of difference, and your support helps spread awareness. We've covered cataracts and glaucoma, two of the most important eye diseases seniors should understand. In the next section, we'll dive into another condition that's often called the leading cause of vision loss in older adults, age-related macular degeneration. This disease doesn't just blur vision, it affects the very center of your sight, the part you rely on for reading, driving, and recognizing faces. So stay with me, because this is where things get even more crucial. When we think about the most important part of our vision, it's often the ability to see straight ahead, reading a loved one's expression, enjoying the detail in a painting, or safely driving. That central vision depends on the macula, a tiny but mighty part of the retina. And this brings us to age-related macular degeneration, commonly called AMD. It is one of the leading causes of vision loss in people over 60 now. Here's what makes AMD especially concerning. It doesn't usually cause complete blindness, but it can take away the sharp, central vision you rely on every day. Imagine trying to read a book, but the center of the page looks blurry or even missing, while the edges remain clear. That's how AMD feels, and it can be very frustrating. There are two main types: dry AMD, which accounts for about 80 to 90% of cases, and wet AMD, which is less common but more severe. In dry AMD, the macula slowly thins and deposits called drusen build up under the retina, gradually distorting vision. In wet AMD, abnormal blood vessels grow under the macula and leak, causing rapid vision changes. The National Eye Institute estimates that millions of Americans are living with AMD, and that number is only expected to rise as the population ages. But here's where we need to focus. While there is no cure, there are many ways to reduce the risk and slow progression. One of the biggest factors is nutrition. There is solid scientific evidence, including the famous ARED studies funded by the National Institutes of Health, showing that certain vitamins and minerals can significantly reduce the risk of advanced AMD. This includes a combination of vitamin C, vitamin E, zinc, copper, lutein, and zeaxanthin. Lutein and zeaxanthin are carotenoids found in leafy green vegetables like kale, spinach, and collard greens, as well as in egg yolks. They act almost like natural sunglasses inside your eyes, filtering harmful blue light and protecting the macula. Omega-3 fatty acids are another important nutrient. Fish like salmon, mackerel, and sardines, or plant-based sources like chia seeds and flax seeds, provide essential fats that support retinal health. A diet rich in these foods is not just good for your eyes, it also supports brain and heart health, which is a win-win for older adults. Lifestyle choices matter too. Smoking, once again, is one of the biggest risk factors for AMD. In fact, smokers are about twice as likely to develop AMD compared to non-smokers. Protecting your eyes from ultraviolet light, keeping blood pressure and cholesterol under control, and maintaining a healthy weight all play roles in protecting your macula. For those already diagnosed with AMD, doctors may recommend special supplements based on the AREDS formula, and in cases of wet AMD, treatments like injections can help slow down abnormal blood vessel growth. While the thought of eye injections may sound daunting, many patients report they are quick and often effective at preserving sight. Most importantly, regular eye exams with a dilated checkup can catch early changes in the macula before symptoms become severe. Early detection gives seniors more options and more time to protect their vision. Now, let's move to another condition that many seniors may not immediately think about, but is increasingly common: diabetic retinopathy. This one is especially important because it connects directly to another major health issue: diabetes. If you or someone you know is living with diabetes, then you should know that diabetic retinopathy is one of the leading causes of blindness in working-age adults, and the risk only grows as we age. This condition happens when high blood sugar damages the tiny blood vessels in the retina. At first, you may not notice any changes in vision at all, but over time, the vessels can leak fluid or blood, causing swelling, scarring, and eventually, vision loss. The Centers for Disease Control and Prevention estimates that about 1 in 3 people with diabetes over the age of 40 already show signs of diabetic retinopathy. That's a huge number, but the key here is that much of the risk can be reduced with good diabetes management. So how do we do that? First and foremost, keeping blood sugar levels in a healthy range is critical. Consistent monitoring, following medical advice, and making smart food choices are central to protecting your eyes. Whole grains, lean proteins, plenty of vegetables, and low glycemic fruits like berries can help keep blood sugar steady. On the flip side, sugary snacks, sodas, and processed foods can worsen blood sugar spikes and increase the risk of eye damage. Blood pressure and cholesterol management are also essential, because both of these factors affect blood vessel health in the eyes. High blood pressure can accelerate the damage caused by diabetes, while high cholesterol can contribute to the buildup of fatty deposits in blood vessels. There's also strong evidence that physical activity helps reduce the risk of diabetic eye complications. Even simple activities like brisk walking for 30 minutes a day can improve insulin sensitivity, stabilize blood sugar, and support circulation in the eyes. For seniors with diabetes, eye exams are non-negotiable. The American Diabetes Association recommends at least 1 comprehensive eye exam per year. That's because early diabetic retinopathy often has no symptoms, but an eye doctor can spot subtle changes before they cause vision problems. Treatments like laser therapy, medications, or surgery are more effective when the disease is caught early. It's worth noting that some people think of diabetic retinopathy as inevitable if they've had diabetes for many years, but that isn't true. Many older adults successfully protect their vision by staying on top of their blood sugar and health management. It's about consistency and awareness, not perfection. So far, we've covered cataracts, glaucoma, macular degeneration, and diabetic retinopathy. These 4 conditions alone account for most of the vision challenges seniors face. But there's still one more very common condition we need to talk about, one that nearly everyone experiences as they get older. It doesn't cause blindness, but it can certainly affect quality of life, and that's presbyopia. Before we get into it, let me remind you, if you're finding this video valuable, please subscribe and leave a comment below. Share your own experience with any of these conditions, because your story might inspire or guide someone else who's struggling with their vision. In the next part, we'll explore presbyopia, the natural changes in focusing ability that happen to nearly all of us with age, and we'll wrap up with some practical strategies to protect your eyes. Maintain independence and keep seeing the world clearly for years to come. Now let's talk about presbyopia, a condition that affects nearly every person as they get older. Unlike cataracts or glaucoma, presbyopia isn't considered a disease. It's a natural part of aging. But that doesn't mean it isn't frustrating. Presbyopia happens when the lens inside your eye gradually loses flexibility. In younger years, the lens easily changes shape, allowing us to focus on objects up close, like reading a book or threading a needle. But as we reach our 40s and beyond, the lens stiffens, making it harder to focus on near objects. That's why so many people notice they have to hold reading material farther away to see it clearly. Or they find themselves needing reading glasses for the first time. Almost everyone will experience some degree of presbyopia. The most common solution is simple. Reading glasses, bifocals, or progressive lenses can correct the problem and restore clear vision up close. For those who prefer alternatives, there are also contact lenses designed for presbyopia and surgical options like lens replacement or laser procedures. While presbyopia itself cannot be prevented, there are ways to make the transition easier. Good lighting is important. Seniors often need brighter light to read comfortably. Taking breaks from close-up tasks like phone use or sewing can reduce eye strain. And practicing the 20-20-20 rule every 20 minutes, look at something 20 feet away for at least 20 seconds, helps relax the eye muscles. Although presbyopia is not dangerous, it can impact quality of life. Tasks like reading medication labels, signing documents, or enjoying hobbies may become challenging without correction. The key here is not to ignore it. If you find yourself straining, squinting, or struggling to focus, an eye exam can confirm the changes and provide solutions that make daily life easier. So now we've walked through the top 5 eye conditions seniors must know about: cataracts, glaucoma, macular degeneration, diabetic retinopathy, and presbyopia. Each one presents unique challenges, but each also comes with ways to protect your vision and maintain independence. Let's tie everything together with practical strategies that work across the board. First, nutrition. Think of your plate as your eye's medicine cabinet. Brightly colored fruits and vegetables, especially those high in carotenoids like lutein and zeaxanthin, act as protectors of the retina. Citrus fruits, berries, and bell peppers supply vitamin C, which supports blood vessels in the eyes. Nuts and seeds provide vitamin E, which defends against oxidative damage. Fatty fish supply omega-3 fatty acids that support retinal and optic nerve health. Making these foods a part of daily meals is one of the simplest, most natural steps you can take for lifelong eye health. Second, lifestyle habits. We cannot emphasize enough the importance of not smoking. Smoking raises the risk of cataracts, accelerates macular degeneration, and contributes to overall vision decline. If you've struggled to quit before, even reducing the number of cigarettes each day lowers risk. Pair this with protecting your eyes from the sun with UV-blocking sunglasses and wide-brimmed hats, and you give your eyes less stress over the years. Third, manage overall health. Remember, the eyes are connected to the rest of your body. High blood pressure, high cholesterol, and diabetes all increase the risk of eye disease. Working with your healthcare team, staying active, and following recommended medications are not just about heart or blood sugar. They are directly protecting your eyes as well. Fourth, regular eye exams. This cannot be stressed enough. Many eye diseases, especially glaucoma and diabetic retinopathy, begin without obvious symptoms. By the time vision changes are noticeable, damage may already be advanced. A comprehensive eye exam once a year or as recommended by your doctor is your strongest defense. These visits may include dilation, pressure checks, or imaging of the retina, tools that allow eye doctors to catch problems early when they are most treatable. Finally, remember the emotional and practical side of vision health. For many seniors, changes in eyesight can feel discouraging. Reading may be slower, night driving less comfortable, or colors less vibrant. But acknowledging these changes early and taking steps to address them makes a huge difference in maintaining independence and quality of life. Glasses, magnifiers, improved lighting, and adaptive tools are not signs of weakness. They are tools of empowerment, keeping you connected to the world you love. So here's the takeaway. Aging eyes don't have to mean losing vision. With awareness of these 5 common conditions, a proactive approach to nutrition and lifestyle, and regular checkups, seniors can protect their vision and even prevent blindness in many cases. Your eyesight is precious, and protecting it is one of the greatest investments you can make in your health and happiness. Thank you so much for watching this video. If you found it helpful, please subscribe, like, and share it with someone who could benefit. Your support helps spread valuable eye health information to seniors everywhere. Take care of your eyes. They are your window to life's most beautiful moments.